Hi, my name is Namita Kansal, and today I will be discussing the research we have conducted evaluating influenza and COVID-19 vaccine hesitancy among pregnant women using the health belief model. We know that pregnancy increases both influenza and COVID-19 morbidity and mortality. Although the influenza and COVID-19 vaccines in pregnancy lower the likelihood of infection and severe illness, only 61.2% of pregnant women received the influenza vaccine nationally during the 2019-2020 influenza season. Many theories of health behavior, including the health belief model or the HBM, have been used in the literature to predict behaviors. The HBM specifically is often used to understand vaccine hesitancy using its four core constructs, including perceived susceptibility of infection, perceived benefits of vaccine, perceived barriers of receiving the vaccine, and perceived severity of infection. This study was a cross-sectional study with recruitment occurring between November 2020 until March 2021 at an outpatient high-risk obstetrics clinic in Durham, North Carolina. Participants included English-speaking and Spanish-speaking pregnant women with at least one prenatal visit who voluntarily completed a survey. This survey consisted of true or false, multiple choice, short response, and 4-point Likert scale questions. COVID-19 vaccine uptake intention was assessed by the following question. If a vaccine for COVID-19 were to become available during your pregnancy, would you get that vaccine while pregnant? As I mentioned earlier, recruitment began in November 2020, so participants who took the survey during the earlier months participated at a time when the COVID-19 vaccines had not yet been made available to the public. Influenza vaccine uptake intention was assessed by the following question. Will you get the flu vaccine during this pregnancy? The HBM constructs with relation to the influenza vaccine were made into scale variables, with the following definitions in mind. Perceived susceptibility was a person's belief that they are at risk of falling ill with the influenza in pregnancy. Perceived benefits is a person's belief on the effectiveness of receiving the influenza vaccine in pregnancy. Perceived barriers are the person's feelings towards the obstacles impeding vaccination in pregnancy. And finally, perceived severity is a person's feelings on the seriousness of contracting influenza in pregnancy. In total, 89 completed surveys were included in this study. As Figure 1 depicts, of the participants in the study, 32.6% reported COVID-19 vaccine uptake intention, whereas 75.3% reported influenza vaccine uptake intention during pregnancy. Tables 1 and 2 show all four core constructs of the HBM are significantly associated with both influenza and COVID-19 vaccine uptake in pregnancy. Increased perceived susceptibility and perceived severity of influenza infection in pregnancy were significant indicators of influenza and COVID-19 vaccine uptake. Increased perceived benefits and decreased perceived barriers of influenza vaccination in pregnancy were significant indicators of influenza and COVID-19 vaccine uptake. In conclusion, healthcare workers and public health groups could improve influenza and COVID-19 vaccine uptake in pregnancy by 1. Increasing the perceived susceptibility of influenza and COVID-19 illness in pregnancy, 2. Increasing perceived benefits of vaccination for both mother and fetus, 3. Reducing perceived barriers to vaccination, and finally 4. Increasing perceived severity of illness in pregnancy. This research would not have been possible without the support of Duke University School of Medicine and the Duke Department of Maternal and Fetal Medicine. I would like to especially thank Dr. Brenna Hughes for her support and guidance. Thank you for listening to this presentation.